Obtaining vital signs is an important component of the EMS patient exam. A set of vital signs should be obtained on every patient following the primary survey and the treatment of life-threatening injuries. Often, an underlying problem can be discovered on a patient that had an otherwise normal primary survey. Take body substance isolation precautions. Prior to performing the procedure, take and verbalize body substance isolation precautions and quickly put on protective gloves. Obtain the necessary equipment. To gather a full set of vital signs, you will need a timer, stethoscope, sphygmomanometer, pen light, thermometer, pulse oximeter, and a blood glucose meter. Assess pulse rate and quality. Before you begin, if the patient is conscious, briefly explain the necessity of obtaining their vital signs. In most patients, the radial artery is the most convenient place to palpate a pulse. In unconscious patients, a carotid pulse is more appropriate. To assess the radial pulse, locate the radial artery on the lateral aspect of the wrist. This is on the same side as the thumb. Take your first two fingers and apply moderate pressure until you feel a pulse. The first thing you will evaluate is the number of beats per minute, or pulse rate. Count the beats while looking at a timepiece and record how many beats are felt in 1 minute. A normal adult's heart beats between 60 and 100 beats per minute. Slower than 60 is referred to as bradycardia, and faster than 100 is known as tachycardia. Next, assess the quality of the pulse. A normal pulse should be regular and strong. If a pulse is found to be irregular, weak, or bounding, it should be documented, as this may be a sign of an underlying medical condition. Assess respirations, rate, and quality. After assessing the pulse, you want to assess the patient's respirations per minute. Discretely count the amount of times the patient takes a breath in 1 minute. The normal rate for an adult is between 12 and 20 respirations per minute. Document if their breathing is slow, normal, or rapid. Note, the regularity of the breaths typically varies and could be caused by different factors, such as talking. Examine the skin. Look at and feel the patient's skin. Color, temperature, and condition, as in moist versus dry, can help assess the patient's perfusion. Check the patient's nail beds or inside the lower eyelids for color. A pale or blue tint is a sign of inadequate perfusion and may be due to a serious condition. Feel the patient's skin with the back of your hand. If it is too hot, it may be due to a heat-related emergency or an infection. If it is too cold, it may be due to poor perfusion. Finally, assess if the patient is moist or clammy. A normal patient should have warm and dry skin. Examine pupils. The pupil is the black center of the eye. Assess the pupils to check the neurologic function. The pupils will either constrict or dilate depending on the amount of light entering the eye. This is called reactivity. First, note the size of the pupils before you begin the assessment. Shine the pen light into the first eye. Note the reactivity and repeat with the other eye. The pupils should react in the same manner. Note if they are sluggish, unresponsive, or uneven, as this could be due to a neurologic impairment such as stroke or head injury. Factors that can also affect pupil reactivity are drugs, both recreational and prescription, eye drops, eye injury, or blood loss. Determine blood pressure. Begin by locating the brachial artery. Next, apply the sphygmomanometer to the patient's upper arm. Apply the diaphragm of the stethoscope onto the brachial artery at the crease of the elbow. Inflate the cuff until you hear a pulse. Continue to inflate until the pulse is no longer heard. Inflate the cuff until the gauge reads 30 millimeters of mercury above the last time you heard a pulse. Slowly deflate the bladder. Note, when you hear the pulse return, this is the systolic pressure. Continue until the pulse can no longer be heard. This is the diastolic pressure. Record your findings. If you do not have a stethoscope, you can palpate a blood pressure. Feel for the radial artery. Inflate the cuff 30 millimeters past the last time you felt a pulse. Deflate the cuff until the pulse returns. This method is only used for determining the systolic pressure. If the pulse returns when the gauge reads 120 millimeters, it would be recorded as 120 over palp. Automatic blood pressure monitors may also be used. Temperature. The patient's temperature may be an important factor in determining the condition of the patient. Most patients will have a temperature reading between 96 and 100 degrees Fahrenheit. A high reading may indicate an infection, while a low reading may indicate hypothermia. There are numerous locations in which to take a temperature: orally, rectally, axillary or armpit, or tympanic ear. Rectal, oral, and axillary temperatures can be taken using the same type of device, whereas a tympanic thermometer must be used to gather a reading from the ear. Note, rectal temperatures are typically 1 degree higher than the thermometer reading, where axillary temperatures are normally 1 degree lower. Measure of oxygen saturation. Pulse oximetry is important in determining the oxygen level in the red blood cells. Place the finger probe onto the patient's index finger. In a healthy adult, a normal reading is between 96 and 100% SpO2. Lower readings are signs of hypoxia. A patient that is cold or wearing nail polish may have an inaccurately low reading. Measure blood glucose. Begin by placing a test strip into the blood glucose meter. Prepare the patient's finger by wiping it with an alcohol wipe. Allow the alcohol to dry. Then prick the finger with a lancet. Apply a drop of blood to the test strip and document the reading. Normal parameters are between 60 and 120 milligrams per deciliter. A patient with a blood glucose reading less than 60 is referred to as hypoglycemic, whereas a patient with an elevated glucose reading is called hyperglycemic. Note, both hypoglycemic and hyperglycemic patients may show signs of an altered mental status. Monitor the patient. After a baseline set of vital signs is established, continue to evaluate the patient for changes. A stable patient should be reevaluated every 15 minutes, whereas an unstable patient needs to be reassessed every 5 minutes.